Okay, so this is the validity study for the stigmatization experience in atopic dermatitis and psoriatic patients. So, atopic dermatitis and psoriasis cause a lot of psychological stress. These people with these diseases experience psychic stress or daily hassles and perceived stigmatization that can negatively affect their quality of life. Researchers have used a questionnaire on experience with skin complaints. Well, it's a whole questionnaire that's named to differentiate the stigma experience of patients with skin diseases. So they did a study before. Well, the people doing this article in particular did a study before where they looked into the self-esteem of patients with skin disease and saw that patients had feelings of being worthless or worthless, alone, or unclean. They also saw that some people also feel that they lacked physical attractiveness in the context of having a skin disease. They also avoided public situations. They perceived other people's reactions before they even got to see the reactions, and they commonly concealed their disease and like the fact that they have it. So this study was to supply more information about the stigmatization experience of patients with atopic dermatitis and psoriasis. So they examined a group of 76 patients and with psoriasis, and they examined a group of 76 patients with atopic dermatitis and 81 with psoriasis, and then also they looked at a group of 217 patients with psoriasis, but it was at another department, and most of them had been studied before for the other study. They gave them a 34-item questionnaire that is a self-rating instrument that focuses on the feelings of stigmatization of patients with diseases. Socio-demographic data were taken for every group. The degree of the burden was selected as the thing that should highly correlate with feelings of stigmatization, and then there was also the duration of disease and the severity that were also there. They also used the current skin state to see the degree of feeling stigmatized. So basically they hypothesized that the more visible the skin disease was, the worse the feeling of stigmatization was, and the people with like the skin disease on their sensitive places would feel also more stigmatized. There. Okay. So the study showed that people with sensitive regions affected felt more stigmatized than those with visible versus invisible. So like they felt worse than people that had it show a lot. So the people with but however, the people with the invisible regions weirdly had a lower self-esteem than the people that had more visible skin disease. Like their skin lesions showed more, yet the people that their skin lesions didn't show as much felt worse for some reason. Other studies I've seen don't match this. The questionnaire, but in the end, the questionnaire on the experience with skin complaints stressed the relevance of the stigmatization experience of patients with atopic dermatitis and psoriasis, and it more importantly emphasized that the people affected in their sensitive parts are having a worse experience than the other patients. However, this is all, like the article says that this is all affected by the fact that like the people's attitudes were affected by the idea that they were dealing with an internal feeling of stigmatization. So since they were asked about it and they knew about it, this affected how they would answer in the questionnaire. So it's not completely valid.